Alopecia, or hair loss, is a common side effect of cancer treatment, particularly chemotherapy and radiation therapy. This hair loss can be distressing for many cancer patients, as it affects their self-esteem and body image. Here are some key points about alopecia due to cancer treatment. Chemotherapy-induced alopecia. Many chemotherapy drugs target rapidly dividing cells, including cancer cells, but also hair follicles. This leads to hair loss on the scalp and other parts of the body. The extent and duration of hair loss can vary depending on the type and dosage of chemotherapy. Radiation therapy-induced alopecia. Hair loss can occur in the area receiving radiation therapy. This is often localized to the specific treatment site, and hair may or may not grow back after treatment is completed. Types of hair loss. Depending on the treatment and individual factors, patients may experience various types of hair loss, from thinning and gradual loss to sudden and complete baldness. Eyebrows, eyelashes, and body hair may also be affected. Temporary or permanent. In most cases, chemotherapy-induced hair loss is temporary. Hair typically starts to regrow within a few weeks to a few months after treatment ends. However, for some individuals, it may take longer, and in rare cases, it can be permanent. Radiation-induced hair loss can be temporary or permanent, depending on the radiation dose and the individual's sensitivity to radiation. Coping strategies. Coping with cancer-related hair loss can be challenging. Many patients choose to wear wigs, scarves, or hats to conceal hair loss. Some opt for no head covering at all. Support groups, counseling, and connecting with others who have experienced similar issues can provide emotional support during this time. Preventative measures. Scalp cooling or cold cap therapy is a technique that can be used to reduce the risk of hair loss during chemotherapy. It works by constricting blood vessels in the scalp to limit the amount of chemotherapy drugs that reach hair follicles. However, it may not be suitable for all chemotherapy regimens. Hair and scalp care. It's essential for cancer patients to take gentle care of their hair and scalp during treatment. This includes using mild shampoos, avoiding hot water and excessive heat when washing the hair, and using a soft brush or wide-toothed comb to minimize hair breakage. Consult with a healthcare team. Patients should discuss hair loss concerns with their healthcare team. They can provide guidance on what to expect and potential options for managing hair loss during and after treatment. Remember that cancer treatment and its side effects, including alopecia, can vary greatly from person to person. It's essential to focus on healing and recovery during this challenging time and to seek support when needed. There are various resources and organizations that can provide support and information to individuals dealing with cancer-related alopecia.